The origin of IQ endoscopes came from its clinical founder, Dr. Patrick Wood-Booth, who was a clinical endoscopist and saw that with the doubling of capacity of endoscopies in the world, the current technology, which is reusable technology, can't be scaled quick enough to meet that demand. So what we're trying to do at IQ endoscopes is not replace reusable technology. We see our single-use device working alongside reusable technology. So you can take your patients who require reusables, place them in the endoscopy room to your capacity, and then you can open up extra capacity clinics, whether it be in an outpatient setting, a community setting or a clinic setting, to tackle extra patients who are currently waiting a long time for their treatment.
Innovation is key to our health service. New technologies, new process are coming through all the time, and the only way we're going to change the NHS is if we keep up with it. We do things differently. The endoscopy waiting list was one of our burning platforms as a health board, but not just in Cardiff and Vale, but across Wales.
The response from clinicians about the endoscope has actually been really favourable. The scope itself has a really good image. It was also lighter, and it really does have the full range of things that we need for everyday diagnostics.
So in the CCR award, phase one was very much about proving the sustainability of both IQ endoscopes and our device. So we looked hard and did a lot of research around sustainability in endoscopy, sustainability of the processes we're going to build, and how we are building a company for a sustainable future. Phase two was really about building the product, checking it was meeting clinical requirements, and doing the research into the exact endoscopy problem in Cardiff and which bits could we solve or not. Phase 3 is now about the clinical demonstration of the product to the end users. Furthermore, through using the CEDAR team, we've been able to identify the hypothetical areas that they want to use the product and now map the true health economics about those patients.
Our findings have fed into the development of the design and the use case for the endoscope. We factored in so many elements to evaluate the endoscope and its potential adoption in the health board that it's got a lot better chance of succeeding, and we know the real potential benefit that it might have.
So what's come through with this project is just how important sustainability is in medical devices in general. We know we're launching a single-use product, and with that comes responsibility. The exciting thing for IQ endoscopes is we're not already a big corporate. We're not a big giant with a manufacturing footprint, with set processes. We can develop them from scratch. So what we can take is all of the aspects of sustainability and make sure we really look at our supply chain, our manufacturing methodology, the material choices, so we can have sustainability as a core part of our manufacturing process and our commercialization process from the very beginning.
Challenge Fund has been crucial for this innovation. We wouldn't have been able to direct the resources in terms of people and the health economics that we've been able to do without the Challenge Fund. Early involvement of clinicians and managers who understand the pathways and understand the patients with startups, with SMEs who are developing a technology is really useful. It stops people wasting time. So I think that where we go next will be really interesting. The approvals are all coming through for the scope, so there'll be a commercial element that IQ endoscopes want to explore. What we want to do from an academic point of view will be help generate the evidence that shows that this is a useful addition to the range of solutions that we have for diagnostics.
So the next phase of the business is really about getting us ready for commercialization. We've created about 30 jobs in Wales. We brought engineering in-house, we brought in a quality and regulatory department, we've created finance jobs, we've created marketing jobs. The plan now is to keep growing, and we see ourselves being a flagship for what can be done in Wales.